News of a patient with Ebola-like symptoms at the Kericho Referral Hospital had prompted a scare in the wake of reports that the disease has already spread to neighboring Uganda. The government activating mitigation mechanisms, including heightened surveillance along the country's borders as well as airports, with Health Cabinet Secretary Sicily Kariuki allaying fears of an outbreak of the disease in Kenya. Speaking during a tour of the Jomo Kenyatta International Airport, the Health CS said the country remains alert and well equipped to deal with any threats posed by the disease.
I am here today to confirm that we do not have any cases of Ebola in the country today.
In Busia, along the Kenya-Uganda common border, authorities remained on high alert.
We want to ensure that everybody coming into the country is properly screened, and we also take history about the country of origin.
In Kericho County, County Executive in charge of health, Shadrach Mutai, says they are not taking anything to chance. The county administration saying they have already placed 3 people who are directly in contact with a 36-year-old woman who was on Sunday isolated at Kericho County Referral Hospital after expressing Ebola-like symptoms as a precaution.
We are treating this as a suspected case, but it's not Ebola.
The woman, who had traveled from Malaba in Busia County on the eastern border of Kenya and Uganda, was admitted at Siloam Hospital before being transferred to Kericho Referral Hospital after exhibiting Ebola-like symptoms. Meanwhile, the World Health Organization has dispatched experts to Kericho who are already helping with investigations of the case. Center for Disease Control states that a person infected with Ebola is not contagious until symptoms begin, with the time from exposure to when signs or symptoms of the disease appear between 2 to 21 days. Signs of Ebola include fever and symptoms like severe headache, fatigue, muscle pain, vomiting, diarrhea, stomach pain, or unexplained bleeding or bruising. Ebola is spread through direct contact with blood and body fluids through broken skin or mucous membranes. Blood and body fluids including urine, feces, saliva, vomit, sweat, and semen of a person who is sick, and through objects like needles that have been contaminated with the blood or body fluids of a person sick with Ebola. Ebola, however, is not spread through the air, water, or food. Although there is no approved vaccine available for Ebola, there are ways you can protect yourself against it. In any suspected case, one is advised to wash their hands often with soap and water, not to touch the blood or body fluids like urine, feces, saliva, vomit, sweat, and semen of people who are sick. Avoid handling items that may have come in contact with a sick person's blood or body fluids like clothes, bedding, needles, or medical equipment, and also avoid touching the body of someone who has died of Ebola. In case you get sick with a fever or other Ebola symptoms, get medical right away. Get medical care right away and notify local health authorities. Purity Musel, Channel 1 News.